Hey guys, it's Jen. I hope you're all doing well. Welcome back to the iFitNurse Pearls series. This is video number 7, discussing a Foley catheter insertion skill. Common things that I've seen, things that you can improve on to help you be successful in getting that Foley catheter in the first time, okay, and within a patient. I will say first, let's just get it out the way. Males are obviously a lot easier to insert a Foley catheter. There's just one hole for the most part. Yeah. So then I just want you to focus on getting the appropriate size for the patient, okay? Using the correct diameter. You don't want any leakage to occur. And following all your aseptic techniques. And they're normally listed on the Foley catheter packet. Yeah, so obviously be clean, aseptic as possible. You do not want to introduce any microbes that could cause any UTIs or anything like that. So as you start your journey on, let's say, working or inserting Foley catheters, try and find male patients first to practice on. Try and get as many of those under your belt, because at that point, you would be focusing on the aseptic technique, the sterile gloving, how to connect the balloon inflation syringe, you know, how would you put the lubricant, how do you clean? So all those little steps of not only knowing how to do it, but what's available, what goes where, you can learn that and then feel comfortable with using the supplies that your facility is providing you. And depending on the patient, you might sometimes need a second nurse to help kind of hold things in place, or just an extra pair of hands sometimes does not hurt. And sometimes you can't be successful unless you have a second pair of hands, okay? The number one thing is you want to prevent any collapses, any catheter associated infection. So this is a big one. So Foley catheters, whenever you can, get them out, get them out. So you want to prevent any additional infections that could make things more complicated for your patient. You don't want them to get an infection. If they already have an infection, you don't want to add a second one. So obviously make sure that you are doing sterile technique for everything. And if you're not, stop, go get yourself a whole new set of supplies and start over. Okay, yeah, that is extra time, but again, think about your patient. For males, so as you, let's see, improve, get comfortable with this skill, I really just suggest get a couple of male patients out of the way and then learn what you have. Then go ahead and move on to your female patients. And of course, this does not mean that you have to turn down an opportunity to get a Foley in a female patient, but I'm just saying to start off with, that's probably what I would recommend. So then you get a couple of Foleys into males, perfect. So you know what's available, what's in the kit, the steps you need to do. And then now let's talk about a female patient. So in the beginning, I remember, I think in nursing school, they always say it'll wink at you. And I'm like, the urethra will wink at you? Like, I don't understand. I don't understand. And then I think at one point I was like, yeah, no. And I'm looking and looking and looking, and I think I saw what they were talking about. For lack of a better term, it looks, I don't want to say like a star, but like if you look at an anus, like just the appearance, obviously, from around the wrinkles, that's what it looks like. It's just like a little urethra, and sometimes you have to adjust your hand and positioning, and sometimes may need another nurse to help open and keep the skin taut and out of your way, and then your hand strong enough to be able to open so you can visually see where you're going. What you don't want to do is go in, there's no urine, come out and go in. No, don't do that. I've seen it done so many times. Please don't. Please don't. So what you just did is you probably went to the vagina. Any bacteria, anything like that, you just took it out of there. It's on your Foley catheter. And now, let's say you get into the urethra. Oh, there goes a UTI. You don't want to do that. So sometimes what we do see is you leave that catheter in place, go get a whole new set, clean the entire area again, and then go in there so you're not going in the incorrect hole. I have seen that, and I feel two different ways about it. It helps, especially in difficult situations, but you want to clean, and I don't want you to keep causing any trauma to the patient either. So get another nurse. Sometimes what I've seen that's helped me is holding and then having a second person holding, maybe shine a flashlight, because at this point my dominant hand is my sterile hand and this is my dirty hand, and so it's on the patient. And sometimes, like this motion, if that makes any sense, you go in and you're opening and you are just, you know, explain to them, okay, you're gonna feel some pressure. I'm opening up right now. I'm cleaning. That's probably the worst part so far that I've initially, because it's so cold. The iodine's so cold. And make sure that you are assessing for any allergies. Are you allergic to shellfish or the iodine? I'm gonna clean you with it, you know? So open up. Have a second nurse there and shine a light just to see if you can visualize it, okay? And then you should see it's really tiny and you can see like all of the, I'm gonna call them wrinkles. And then you get the Foley catheter about, let's say, 3 inches, and you hold it from there, because what you don't want it to do is hold it like 10 inches out or whatever and it's all flopping. Like, you don't want that. So get about 3 inches, and so this area should be pretty stiff. You want it to, so it doesn't flop around, because once you get in there, so let's say my finger is it, you don't want it to just like bend, because if I'm holding all the way over here, it has no type of support to stay straight. So you hold it there, I guess we'll say that, and then you start pushing pressure, and then you start advancing the catheter. Okay? I always tell someone to count to, you know, I count to 3, take a deep breath on 3, and go ahead and advance. So once you're in there, you should see urine return, okay? Make sure you inflate your balloon, and then you kind of pull a little bit, make sure that you feel like it's secure. Observe the area. Is there any blood? What's the color of the urine? How much did you get out of it? Make sure you're doing great Foley care. You do not want to cause an infection. And then always assess your patient. Are they appropriate for me to start removing this Foley catheter? I know it's a pain. I know it means, like, say if they're going to be peeing, more work for you. But I want you to think about this. Like, you don't want to cause them an infection. You don't want to leave something in that they no longer need, okay? You want them to get better, get out of there, get out of the hospital and go back to their life, okay? I don't want you to leave those catheters, and this goes for like central lines and all these other lines that are no longer appropriate for a patient, okay? Any foreign object, and these are foreign objects, are a source of bacteria that could cause an infection, and if someone's already immunocompromised, that could be a big deal. Foley catheters, just to recap, make sure you have an order for it, obviously. Assess the patient, find out what size you need, what's appropriate. Sterile technique, ask for help, ask for assistance to be able to open and help you position the patient. Having the patients kind of bend their legs almost in like a labor position sometimes helps. Having the bed at an appropriate height will give me enough, at a good height, it will give me enough, it will make it comfortable for me to take a look. Obviously cleaning, using lubricant, enough lubricant to be able to glide the catheter in there. Doing Foley care. So part of my, let's say every 4-hour care, which is like oral care, my vital signs and all that stuff, I always do Foley care. You can never wipe too much down there, especially when you have a Foley catheter. So obviously at that point you clean where it meets the urethra and you clean downward, okay? So just hold and just clean. You want to just be thorough, be clean. I'm sure your patients will appreciate the fact that you've taken these extra steps to help them reduce the probability of getting an infection. Like everything, go ahead and watch other people insert Foley catheters in the beginning. If you are not too comfortable doing it, go ahead and pull up, let's say, your nursing book, or even at work, there should be a reference, a nursing skills area where you can review and just put Foley catheter insertion, and then you can review the steps, watch videos, talk to nurses, and then have someone observe you do it, and then correct any techniques that you are doing that are not correct, okay? And like always, practice, practice, practice. If you see an opportunity to do it, take it. Don't be afraid. What I always tell my students is, if you haven't done it before, at least say, I have not done it before. I am willing to try if you walk me through it. I love hearing that, because I am there to learn. If I know that you are eager to learn and are willing to put yourself in that position and try, that's all we can ask for. What you don't want to do is, I've never tried it before, I don't want to do it. And I will also respect, I have not done it before, can I watch you do this one and I can do the next one? Absolutely, absolutely. So I hope you got something out of it. If you have any questions, leave in the comment section below. Don't forget to comment, like, and subscribe, and share the videos. Bye.